for it to click in.
Lewis is looking for the link.
Live streaming is in.
Wonderful. Good afternoon, everyone. We're almost done. We'll be done next week, next Monday. Thank you, everyone, for coming this afternoon. We have a couple of bills today, Senate Bill 923, and we have Senate Bill 741. We have heard these bills in hearings, and they're here today. Aaron sends you the interlineated copy and everything you need to have this discussion and hopefully a vote. We have invited stakeholders on both sides to come and address us as well. We're going to start first with 923, and Aaron Hopwood, who is our wonderful counsel. Again, Aaron, thank you for all the work you done this session. Will give us a description of the bill. Then we'll open it up for discussion from the stakeholders, and we'll open it up for questions from the committee members. And committee members, thank you so much for the committee. We appreciate you. Aaron, will you please get started?
Senate Bill 923 requires Medicaid to extend coverage for eligible pregnant women with family incomes up to 250% of the federal poverty level for 1 year immediately following the end of the woman's pregnancy. Coverage must include dental care in addition to the comprehensive medical and other healthcare services that are required under current law. There were no amendments offered at the bill hearing, and that is what the bill does.
Wonderful. I know Pam Casemeyer, you're here to speak on it, and anyone else. I am going to look at the participant icon. There's a little thing that says raise your hand. If you will be so kind and do that, then I can follow that order. I see Robin Elliott first. Ms. Elliott, will you please go ahead? And welcome.
Well, welcome. It's very exciting to be here on behalf of many clients on this bill, all in tremendous support. I am here to answer any questions and also to thank the Senate, which has moved the bill, of course, and the governor for including funding for this bill in the supplemental budget, and specifically for dental. That is something that's, as you can imagine, very much supported by the Maryland Dental Action Coalition. And we're excited. It's already in the 60-day package. And so to be able to take that to 12 months is just an incredible possibility. So we thank the committee for considering it.
Our pleasure. Next, we have Ms. Pam Casemeyer.
Hi, yes, very excited to be here too on behalf of a large number of clients. And it is a really exciting bill because it's very bipartisan. As Robin said, the funding for this was put into the supplemental budget even before the bill passed, with an anticipation that we would move in this direction. The federal government just took action. It was in process even before election, but it's been finalized now to ensure that the state can file a plan amendment to get the match, so the fiscal impact got reduced. It's been enacted in a number of states across the country on a bipartisan fashion in both red and blue states. And really it's based on what we understand. Maryland defines maternal mortality as 1 year postpartum. That's after delivery. So this is after the baby's been delivered, 1 year postpartum. That's what our maternal mortality law is. But at the current state right now, pregnant women who can enroll in Medicaid based on their income only get 60 days. And this extends it to a year, which is what the child gets. And so what's been shown through our maternal mortality review studies and in strong evidence else across a lot of research and health data and health outcomes is there are a lot of significant health issues that arise during the first year after pregnancy, whether it's exacerbated existing conditions, whether it's postpartum depression. There's a number of things, and they've also shown that the health outcomes of the infants are better if the mother also maintains coverage during the same period of time that the child has coverage. So this really is like a win-win bill all the way across. I think it's why We are pleased that it's come forward, that we're going to be one of the states that's moving it, that the federal government has recognized it, but also our governor has recognized it by anticipating its passage, by putting money in the supplemental budget already to cover the money that won't be covered by the federal match.
Move the bill with all that.
Hold on a second. Let me see. Are there any questions from the committee members? I see Delegate Shalega. Good afternoon, Delegate.
Good afternoon. Thank you. I do have a question, and I think Erin answered it when she gave her the summary of the bill, but the opposition for Maryland Right to Life says, blah, blah, blah. However, without your amendment, this bill will expand taxpayer funding for abortion by expanding eligibility for the Maryland Medical Assistance Program. But this is just on the postpartum, this, tell me if that is or isn't true. We'll just say it that way.
And
That is
I
No,
not
so-
true.
So
Go ahead,
current, no, it's
Erin.
not true.
if I
current-
can, I
Oh.
was gonna let Erin go ahead and
Oh,
answer.
sorry.
Currently,
It's okay.
these individuals are eligible 60 days after the birth, and this extends that eligibility to a year after.
And
the birth.
this is just postpartum, and it doesn't have
Postpartum.
anything to do with abortion. Is that correct?
Correct.
Okay, thank you.
Thank you. We appreciate you, Pam, anyway, okay?
Sorry, I didn't mean to interrupt.
That's Erin, and I wanted to honor the delegate's request. Any other questions? Oh, yes, Delegate Johnson.
Thank you, Madam Chair. I just wanted to make sure I'm clear. Delegate Shalega, in reading that, they said that without the amendment. So is there, I didn't see any. Is there an amendment or is there no amendment on this bill?
There's no amendment.
Amendment on the House side, they might have been speaking to amendments that were added on the Senate side.
I
Okay.
think she wanted an amendment that would
Well-
specifically exclude abortion services, but this bill doesn't include abortion services, so the, amendment isn't necessary.
All right, thank you.
No problem. Any other questions? On the bill, may I have a motion, please?
Move the bill.
May I have a second? It's been moved in second. Any discussion? Seeing none. All those in favor say aye.
Aye.
Any opposition? Will you raise the little hand, the little blue hand? I see none. Is unanimous. Senate Bill 923 passes unanimous in the subcommittee. Thank you very much to the stakeholders. Thank you for your work and your advocacy over the years. This is a really great bill that will benefit everyone in Maryland. So thank you so much.
Thank
Next,
you all.
our
Well, really,
pleasure.
it's just going to benefit moms and babies, not everyone.
Oh, but it benefits everyone, because if moms and babies are happy and healthy, we're all happy and healthy.
I
Okay?
get that, but you know what I meant.
Absolutely.
Amen to that.
Right? We all are healthy. Senate Bill 741.
So there is a reprint to Senate Bill 741 that I'm going to walk through. In addition to that reprint, there is another amendment that we will discuss after walking through the reprint, if that is okay. So beginning on page 3 through
Hold on
the,
one second, Erin. Does everyone have the reprint that Erin sent? Yes? Okay, great. Go ahead, Erin.
beginning on page 3 through the bottom of page 5. On or before June 1st, 2021, the Department of Health, in collaboration with local health departments, will adopt and implement a 2-year plan to respond to COVID-19. The plan will include measures to enhance public health efforts at the state and local level to mitigate the spread of COVID-19, assess the public and private testing infrastructure in the state and in each local jurisdiction, identify and address the unmet needs for the state and locals, establish specific monthly goals for testing to ensure access, including a goal to achieve the capacity to perform the surveillance testing required to safely reopen schools, higher education, and workplaces, and estimate the funding required to meet the surveillance testing goals and how federal funding can be used to meet the goals. assess the contact tracing infrastructure in place for COVID-19.
Erin, can you, as you're going through this, can you just mention the page if you can, as you're talking?
Yeah, so that was page 3 to the bottom of lines of page 5.
Okay. Thank you.
Okay. The plan would assess the contact tracing infrastructure in place for COVID-19 for state and local jurisdictions, require the department to assist local jurisdictions that adopt strategies to accelerate access to at-home collection and point-of-care tests, and encourage pharmacists and providers to provide testing, and allow each local jurisdiction to establish and implement a program for contact tracing that is independent from the program performed by the state. Moving on to the bottom of page 5 through line 23 on page 6, the amendments strike the requirement that the plan establish a public health jobs corps. On page 6, in lines 24 through 26, the plan is required to have a design that addresses the disproportionate impact of COVID-19 on underserved and minority communities in the state. And on or before June 1st, this plan will be submitted to the General Assembly. Moving on to lines 30 through 33 on page 6, for fiscal years 2021 and 2022, the department will provide $25 million in grants to local jurisdictions to expand capacity for testing and contact tracing. And there's also an amendment here that is part of the House amendment that the grants can be used for any public health purpose related to COVID-19 response for which federal funding is authorized. Moving on to page 7, this outlines how the local jurisdictions are able to use the grant funding. And on page 7 in line 27, this authorizes for fiscal years 2021 and 2022, the Department of Health to provide $15 million each year in grants to local jurisdictions for vaccination efforts. Moving on to page 8, in lines 3 through 7, this provides that only federal funds can be used, and there were amendments added on the bill that strike the authorization to use general funds to implement the bill. On page 8 also, this requires the department to provide up to $9 million in fiscal year 2021 and $36 million in 2022 for assisted living programs and home health agencies in calendar 2021 to cover the cost for testing of residents, patients, and staff. And then also on page 8 in line 28, this requires the Department of Health on or before June 1st, 2021 to develop and submit a comprehensive plan to the General Assembly for vaccinating residents of the state against COVID-19. Page 9 outlines the requirements of the vaccination plan, and there is a proposed House amendment that would require the plan to include a strategy for outreach and distribution of the vaccine to individuals who are not receiving the vaccine, either due to lack of access or to vaccine hesitancy. The department is required to submit the vaccine plan to the General Assembly and provide weekly progress reports on the plan for the duration of calendar year 2021. Moving on to page 10, this requires the establishment of a Maryland Public Health Modernization Work Group that will assess the current public health infrastructure and resources in the state, make recommendations for how to establish a modern and effective public health system with capacity to monitor and control infectious disease, and make recommendations regarding the establishment of a Maryland Public Health Jobs Corps. So you'll recall we struck the language establishing the Public Health Jobs Corps. What the House amendments would do would require this modernization work group to study and make recommendations regarding the establishment of a Maryland Public Health Jobs Corps. And this work group report would be due to the General Assembly by December 1st, 2021. On page 11, beginning on line 14, this requires an institution of higher education that has residence halls for students to establish a COVID-19 security plan that includes screening and testing procedures that will keep students, faculty, and staff safe while on campus for face-to-face instruction during the pandemic. And this plan must be posted on the institution's website. On page 12 in line 8, this includes intent language that the governor include additional funding in the budget of up to $5,500,000 in fiscal 2021 and $22 million in fiscal 2022 to cover the cost of testing of nursing home staff and residents. and this funding must also be federal funds. On page 13, this requires home health agencies for calendar years 2021 and 2022 to adopt and implement a COVID-19 infection control and prevention plan for patients and staff. On page 14, beginning on line 20, this requires a nursing home to adopt and implement a COVID-19 testing plan to ensure that residents and staff are tested on a regular basis, and requires the department to adopt regulations that set standards for the plan. On page 15, beginning on line 19, this requires assisted living programs to adopt and implement a COVID-19 testing plan, and also requires the department to adopt regulations regarding the plan. On page 17, beginning on line 12, this requires health insurance coverage for COVID-19 tests and prohibits the insurer from applying a co-payment, co-insurance requirement, or deductible for the tests. And then on to page 18, this is the language about funding, and it requires the use of federal funds to implement the bill, and also provides that the bill is an emergency measure.
So before we open it up, this bill actually, wow, it's been like more than 6 months of meeting where the Senator Rosa Pett, myself met with the department, with the insurers, with the nursing homes, with anyone that you can think of, in order to, and with the health officers in the schools as well, higher education as well, in order to get input and drafted. The idea here is to have a plan that is cohesive, that can be implemented throughout Maryland for all 24 jurisdictions. The health officers felt very strongly that they needed a bit more support, so it reflects that as well. And the nursing home also expressed their concerns, and you can see it in the bill that addresses different concerns. And we work with the insurers as well. We work with the Maryland Insurance Administration as well, and with Simon from the Legislative Services. That being said, I will open it. There's also an amendment here to address, and I'll let Tom Lewis address the issue regarding facility fees and needing more time to implement that as well. So Tom, why don't I let you start with that issue so we can get it out of the way. You don't have to wait that long, and then we'll get to the members' questions. And Erin is here to answer it myself, right? So Tom, go ahead.
Thank you very much, Madam Vice Chair. Thanks to the members of the committees of the committee. I know you're all very busy. The issue here is with the facility fee requirement that was passed at the end of last session, just as we're closing session for the COVID crisis, and to respond to that. The facility fee, while Hopkins is very, very supportive of that disclosure requirement, and actually had already started on some IT requirements to be able to let people consumers get a full picture of what their actual costs are and what their insurance would cover before that time. But with the COVID response, a lot of our IT, the people who do the same kind of work for the testing scheduling, for now the vaccine scheduling, and half that do that work, have all been very, very preoccupied with the COVID response. And so some of the work that needs to be done to really finish up and do appropriate kinds of IT design and training for staff to be able to give an effective response to consumers when they call in, that will tell them what their facility fee is, what their options are for going to other locations, and what their insurance will cover. That work just has not been able to be done. And so we're asking for an extra 6 months rather than to have that start on July 1st, which we anticipate will still be doing a lot of vaccine scheduling, to have it start on December 31st or January 1st. To get that additional 6 months to be able to really design the system that will be most effective and most appropriate for consumers, so they don't delay care because they think it's more expensive than it actually is. We'd rather not have a bare bones kind of a bit of information for people. We'd rather have this be a very structured, very informative kind of a design. So we appreciate the Vice Chair agreeing to sponsor this amendment. We have spoken to the Senate Chair who was very interested in this issue and understands the need for the delay as well. So we're hoping that the committee will support this issue. I'm happy to answer any questions that may come up.
Are there any questions to Tom Lewis regarding what he just discussed? If there are, can you unmute yourself? Because I think Delegate Shalega, I just saw the hand.
Thanks for being here, Tom.
So thank you, Delegate.
Need an extra 6 months.
Yes, and we need the extra 6 months. We would have liked to have hired more staff, but for these functions, it's because of the COVID crisis. These particular types of staff are in very high demand by all the hospitals and by all the vaccine centers, and so we just need the additional time to be able to get this online.
If I may, and I apologize to Delegate Lewis, you had your hand up earlier before he spoke, so I wasn't sure. I thought it was for the whole bill, so I apologize. You were first, and I know you were the sponsor of the bill, so out of respect to you, go ahead, I apologize.
Thank you so much, Madam Chair, and no apologies needed. There's no shortage of questions here, so thank you so much, Madam Chair. Thank you also, Mr. Lewis, for being here and explaining this amendment to us. I do have kind of a personal attachment to the facility fee bill, although I've been told not to fall in love with my bills. But my question for you, sir, is I understand the need for a little extra time. The pandemic put pressure on all aspects of the healthcare system. My question for you, however, is during that 6-month extra window, is there any thought given to how to protect people from inadvertent or unnecessary facility fee charges? If we're giving extra time just for the healthcare system, for Hopkins and others, to build out their mechanisms, does that also mean that the people of Maryland will still be subject to those burdensome facility fees?
So thank you, Delegate. Yes, there will still be the facility fees, and we do try to inform people of those fees when they are making their appointments. The problems with the IT support are that it will what this would provide, if we can get this developed, is it provides not just the facility fee information, the basics, that here's the facility fee, this is what it costs, but you don't have the opportunity to also get what the insurance coverage is going to be, what the alternative locations might be, and that kind of information, which isn't required by the bill. But if we put it up there without the additional information, the concern from some of our staff is that seeing the facility fee, thinking that that is or what the total cost is without looking at insurance, will discourage some consumers from actually getting care, and they might delay care. That's the worry, but
yeah, that is definitely right. That's a legitimate concern. If I may, Madam Chair, I do like to refer to people using medical services as just people and not consumers. But if, Madam Chair, Mr. Lewis, I'm curious, is there some adjustment we could make on the for the benefit of people getting medical care who might be subject to facility fees? Is there some way we could build in additional protection, for example, to say that during this additional window being offered to hospitals, if, I don't know the best term for this, but if we could consider a moratorium on facility fees or some other mechanism, just sort of thinking out loud and wondering if we could consider that.
Delegate, I'm not sure what the other ramifications might be to doing that. The facility fees are structured into the economics of the system right now. I just don't know what the ramifications of that would be. I'm happy to kind of walk through kind of what the bare bones structure would look like if we had to go forward on July 1st, and go through that with you offline. I don't want to take the whole committee's time, and what we're hoping to be able to do. But I think to do a moratorium on facility fees statewide, I'm just not sure what the ramifications of that would be at this time for patients or for the system and the rate setting system as well. So I just
Thank you for your answer. Thank you, Madam Chair.
Yeah, I know the concerns that the delegate has are very valid. But the fact is that they won't be ready to implement this and they need more time. But Tom, can you give us some sort of commitment that you will use your best efforts to inform, in the meantime? Can you tell the committee that? Can you put something in writing? I mean, can you give us some assurances?
We can provide information about what we will be able to provide on July 1st. So I could send that to you. A delay of or a moratorium on the facility fees, I just don't know what the ramifications of that would be. But we will certainly make an effort to try to do this as quickly as we can.
That would be great. And if you could, I have worked with you for more than 14 years. I know your word is your bond. I'm not worried that you're not going to go back and look into it. So if you could do that, keeping the delegates' concerns in mind. I know it's late, delegate, and this came up last minute, and sometimes that happens. We did tell them that this is only until December, okay, not any later than that. So Tom, if you could please, do your best to communicate with us, and what else you could do during that time, that would be great. Okay.
Yes, I will. Thank you.
Any other questions or concerns? Thank you. Regarding this issue, Delegate Hill, regarding this issue.
Yes, Madam Chair, I'm sorry. I was paying attention and reading this. I just want to be clear. This amendment has nothing to do with the work group section that it comes after. This is trying to fix a separate bill within this bill. Because on my page 10, I'm reading about a work group, and then I see this language, and I want to be clear that I understand what we're talking about here.
Yeah, it has nothing to do with the work group. It was inserted on page 10 because that's section 1 of the bill.
Okay, all right, thank you.
Where it is.
Thank you.
Okay, I think Delegate Johnson, you have a question about this particular issue?
I do, Madam Chair. Thank you.
Go ahead.
In the line of what Delegate Lewis was saying, not a moratorium on fees, but the intent of the original bill. I'm assuming that they are making appointments in person or by phone. Would that be correct, Tom?
Yes, Delegate. People are making appointments. Some are still telehealth appointments. The people are making telehealth appointments, and then these would be the appointments that are going to the to be on site and have the facility fee attached.
So the commitment that I would like to see to the committee is that when they're making these appointments, they are definitely being told about the facility fees. And that was the intent of the original bill. Mm-hmm. So that's the commitment I would like to see to the committee.
Can you give us that commitment, Tom?
Madam Chair, Delegate Johnson, we will continue to provide the information that we try to provide now. We try to provide information to patients, prospective patients, on the fees that they're going to have to deal with, including the facility fee. I've had that experience myself in making appointments, and we will continue to try to do that. I think that the dilemma here with the bill has a very the law that passed last year was a very a requirement for a specific a dollar amount, but then also an offer of alternatives and some additional information that I think is hard to do right now. And without having these IT solutions and really the insurance, what insurance is going to cover. So that's the concern. But we will continue to provide when people have an outpatient center cost. We try to tell people what their facility fee would be for that outpatient center. So,
All right, thank you.
and
Thank
I
you.
can send you a letter about that.
All right, thank you.
Wonderful. About this issue, any other questions? Delegate Hill?
Yeah, and I see Delegate Rosenberg's hand is up too. But I'm sorry. So I'm sorry, Tom.
Let me call on Delegate Rosenberg first, because he was first, and because you already had a bite at the apple, and then I'll come back to you, okay? Delegate Rosenberg, on this issue.
I've worked for Tom for 30 plus years, but my question does not have to deal with this issue.
All right, thank you. Delegate Hill.
Thank you. So Tom, I'm trying to understand. The bill passed last year, and you're saying that what you just said to Delegate Johnson and the chairman is you're committed to continuing to offer patients the same information that you've been offering, which is the information that the bill was enacted to expand upon. And I'm not clear why, knowing what insurance reimbursement is, why that's necessary to tell someone this is what the fee is. We don't know how much of it your insurance will cover, but this is what our fee is. So I'm a little confused about why you can't just tell them what your fee is.
We can tell them what the fee is, and we do. The issue is that the fee can sound intimidating if the patient is looking at that cost as if it is going to be their out-of-pocket cost. So what the bill did was, it seems to me, was to try to give more accurate and more complete information to the patient when they're the prospective patient, when they're making their appointment. That comprehensive information is what requires more work in IT. And that's the factor that's sort of the limiting factor here. But yes, the goal is to provide more complete information to the patients.
So what I would ask, understanding that, the piece that I thought was missing, and Delegate Lewis may have felt differently, was the disclosure part, where you just said there's an additional $100 fee for the facility separate from the doctor, and we don't know how much of that will be covered. That's disclosure. You don't have to tell people you only have to pay 10. I mean, that's the part that was misleading. It's fine. And people weren't getting the part about there's an additional fee because you're not seeing them on this other site. So I don't understand how you can't make a commitment that you'll give all the information, even if it does scare people. I mean, that's what I have to do. And then when you have the IT, then you can fine tune that down, but you still be able to say, there's this fee because you're not seeing them at the office, or because you're not doing it by tele, or because you're not doing whatever. You probably won't be responsible for most of it, but we can't assure you of that. So you may want to consider that. Why can't you tell them that now?
Yeah, we tell them what we think the cost.
That's not what I'm asking.
Who ask, okay.
Don't ask. I'm asking you not to tell them what you think their cost is going to be.
Yes.
I'm asking if you tell them there is a fee.
Yes.
You don't know what your cost will be. It could be none. It could be all. But there is a fee. That was.
Yes. So my experience in going to the Johns Hopkins Outpatient Center, where there is a facility fee, is that when you're making the appointment, they tell you that there is a fee. Here's what the fee is, and that has been the case, and that's going to continue to be the case. So
what we want, Tom, if I may, we want assurances for you and every other hospital that is, listening, is that you will, when you get that call, that you will simply say, you don't even have to know the amount. Just give them notice that there may be a fee. You don't know what that fee is in addition. That's it.
Yes, we do provide that. We'll continue to provide that there is a fee. There is a facility fee when you go to those particular facilities.
Madam Chair, if I may?
Is that?
Yes.
But the fee is a set fee. What people pay varies by their insurance. Can you not tell them there is a fee of $500, there is a fee of $50? I understand it may scare them away. We're concerned that it won't scare them away when they need to know it. So why can't you commit not just to saying there's a vague fee, but there's a $500 fee for the facility?
So
put the amount in. Just say there is a fee of $500. And if you want to add, we don't know, your insurance will probably cover. That's what doctors' offices do all the time. I don't know why this is so hard. If it's that hard to say the number, then it's a number probably shouldn't be charging.
So the facility fees vary based on what services are being provided. And that is part of the problem here, that depending on what services you're getting, you could pay a different facility fee. That is part of the problem with this whole, with this structure right now.
So does that mean you don't know what those, for instance, when I take my car to Firestone, they can say, we're going to take a look, it's going to cost you this. If it turns out, and they call me back and say, it's your brakes, if you want that fixed, it's this. We should also check your rotors, it's going to be this. We should also suggest this. And they can tell me, these are what it's going to be. So if you're going to get an ultrasound, this is what your fee is. If you're just going to be seen, this is what your fee. You guys, you don't know what the fees are that you charge for specific things that the patient is calling to set up an appointment for?
So the issue, so when someone calls, they're trying to make an appointment. It depends on what the services are going to be. The HSCRC has different rates for facility fees based on what the services are. And so what we do now is we give an estimate of what the facility fees are going to be when someone calls to make an appointment. And that's the way it works right now. And the question of whether it can be like going to the auto mechanic and you say how much, you know, it's going to be for brakes or whatever. I mean, sometimes if it's not clear what you're going to be getting, you get an estimate from them too. But in this case, we're trying to come up with an IT system that is going to be very, very precise. And that's what, and I think that is what the bill last year was asking for, or was the goal. Right now, we tell people there's a facility fee for this location. Here's the estimate of what it will be. And that's what we try to do. And we would certainly continue to do that to the extent that we can get this done more quickly. We will certainly be trying to. We're trying to get it done. The issue has just been a lack of capacity, staff capacity in IT in particular.
So,
Thank you, Madam Chair. I'm just not sure.
So if just to summarize, so right now when someone calls, you tell them there is a fee. This is what it is approximately, right? You let them know.
Yes. Yes.
Okay. And in addition, right?
Yes.
And you will continue to do that.
Right.
Try your best to try to get this done quickly.
Yes.
And you
exactly.
email the committee regarding what steps you're going to take for the next 6 months regarding Delegate Robin Lewis's question to make sure that it's done quickly, correct?
Yes. Yes, we will.
Okay. All right. I know it's frustrating. It really is, but you know, and you know, I'm very supportive of it. I know the work that Delegate Lewis put with the Senate. But you know, we are in the middle of a pandemic. They have asked for some time. We're giving them 6 months only, not a year, which is what, you know, they want more. And we said no. So for you to know, so I say, let's have a little good faith and let's let them do their best. And I know that Tom will follow up. Okay.
Yes.
Delegate Johnson, you have another question on this issue?
I just wanted to say thank you, Madam Chair. I wanted to say thanks for getting that nailed down, because if they can let them know there will be a fee, give them an estimate, then they can call their insurance company to see how much of that they will be responsible for. So if they can commit to that until they get this worked out, then I would be happy with that. Thank you.
Wonderful, and thank you for your questions. I know it's frustrating. Thank you so much. So next we have on the bill questions, we have Delegate Rosenberg.
Thank you, Madam Chair.
My pleasure.
Sure. My question would go back to page 10 of the bill, the work group. Would it make sense to add language that simply says that where appropriate, the work group shall consider the use of federal funding for these objectives? Because I'm pretty sure there is money in the bill passed by the Congress, the American Rescue Plan, that could be used. And from a fiscal standpoint, it's helpful if we were to use federal money when it's available. And I think there's mandatory language, as I thought, elsewhere in the bill regarding federal funding. But this, what I'm suggesting is where appropriate, consider where appropriate the use of federal funds.
Aaron?
I think that's fine. We can add that.
Where is it again, Delegate Rosenberg? Which page in line?
Sure.
He's speaking to the work group that's established.
Page 10,
Page 10.
line 13, Delegate Shalega.
So Delegate Rosenberg, as a part of the recommendations, it would be how federal funds could be used.
Consider where appropriate the use of federal funds.
Regarding that suggestion, are there any questions or concerns regarding what he just suggested? Regarding that issue only, will you unmute yourself, please? Regarding that issue only. All right, seeing none, great. Thank you, Delegate Rosenberg. So Aaron, can you make a note of that, please? Thank you.
Yes, I can add that amendment.
Delegate Shalega, actually Delegate Hill was next and then Delegate Shalega.
Thank you, Madam Chair.
Pleasure.
The question is about the encouraging or incentivizing primary cares and pharmacies. One of the problems we saw early on is that those incentives were going out at the cost to the local health departments who had the biggest burden. So I was wondering, I know that supplies of the vaccine are better now, but I'm still wondering if it would not be prudent to add some language to say encouraging or incentivizing primary cares and pharmacies to give without diverting needed supplies from the local health department. In other words, the pharmacies and the primary cares would get the surplus, but since the local health department carries the burden for making sure the most vulnerable people get theirs, that's just what I'm suggesting for discussion.
Aaron.
Can you tell me what page you're on, please?
Yeah, I think it was, because there's another question too. Let me go down. I thought it was 10 or, hold on, testing plan. Sorry, I thought I'd written the page down. If somebody wants to go on while I find the page.
Delegate Shalega.
Yeah, if you want to finish Delegate Hills, I don't know which page she's on.
Yeah, I'm looking for that. That's why I was suggesting you go
She wants
ahead.
a little
Oh, I
time,
see.
Delegate
Okay.
Shalega,
I'm
so
sorry.
she's giving her time to you.
Okay, thank you.
Okay.
I have a number of questions. So my first one is, did HFAM weigh in on this?
They did, and they are supportive.
Okay. My next question is the fiscal note. So it looks like a lot of this funding is federal money. I see the mandates of 3 million. I mean, there's a lot of mandates, a 3 million, a 25 million, a 15 million, another 9 million, a 36 million. Are these things that are already coming from the federal government, or what can you tell us about that?
Yes, it is. It's all federal funds. I think we're about 800 million total in federal funds that we're working from. So it's just a fraction of that 800 million. If you look on page 18, that's where you see that it's all federal funds. The bill as introduced had some general fund language, but that's all been stricken. So everything is strictly federal funds.
Okay, I did notice that on page 18. So this is just being prescriptive and directing where those federal funds go.
Yes, and those federal funds have to be appropriated for the purposes of the bill. So they'd have.
Okay, all right, yeah, and the federal government's not just, well, they are throwing money away, but in this case, they're specifically placing it in different pots.
Yeah, so we couldn't put it towards something that the federal government said that we couldn't.
So on page 4 of the reprint, so it talks about testing. That might be where Delegate Hill was looking on page 4, line 8. It talks about testing. So, you know, after the vaccines have, I mean, we're up to, I just read 3 million vaccines. So we're halfway through our entire population of 6 million. So are you foreseeing that we're going to continue needing statewide testing after all the vaccines have been administered?
Yes, so the numbers are going up, especially as the months get warmer. I mean, they're going up, especially in the younger population as well. So all the public health officials actually that we met recommended that we continue to test and do contact tracing because it's going to be a while before we have herd immunity. There's also, although we have 3 million people or so, whatever the number is that we have tested, there are populations where that percentage is very low, like 2%, 3%. So there's still a lot of work to be done before we get there.
Yeah, I know that's the hesitancy talked about later in the bill. On page 4, lines 9 through 15, talk about opening schools. Is MSDE going to be involved, or have you spoken to them? How are we going to work that?
I know that Senator Rosa had reached out. I don't know what the conversation was, but they were mentioned because they need to be part of the plan as well, right? When the kids go back to school, what the workplace looks like, how do you contain the spread? And I know that we talked to institution of higher education. I was part of those conversations as well to be able to get feedback. That's why it is drafted in that manner, that it's not so prescriptive, it's general, just to leave them.
Should it say in consultation with MSDE? Because we certainly, I mean, I am a huge.
I don't see why that's a problem, Delegate. I'm open to that.
I think we should make sure they're at the table so that.
I agree with you.
Okay, so
Aaron, Aaron, if you could please note that and put that language in there.
Yeah, so I think that would go on page 3.
Okay.
So to do this plan, they have to collaborate with local health departments. We can put MSDE in there.
That's really important. It's a good point, Delegate Shalega. Thank you.
So then thank you. On page 5, it talks about lines 25 to 29. It talks about local jurisdictions, contact tracing, and the state doing contact tracing. I have a couple questions about that. Are we somehow going to make sure we're not duplicating those efforts?
Actually, the public health department wanted this language, and you don't duplicate because a lot of the contract that the state have been issued, and they're working with the local 24 jurisdictions, the public health officers. So they're working closely with the state as well. So they didn't see a problem with it, and they wanted this language. They want a little flexibility.
Okay, and how about any kind of language about the security of people's private information? I think that's part of the problem with contact tracing is people don't want the government tracing them. and
I think there's-
storing their data, storing their information, putting them on a list, so to speak? I mean, do we have some, and there may already be provisions for, security of people's private information?
There's already in law, there's provisions already in law to protect that under HIPAA and some state regulations as well. So it wouldn't be needed, it will be redundant. And Erin, you can go ahead and add to it if you like.
I know MDH is on this call, so they might be helpful in that regard.
That'd be nice to hear, because I do hear that out in the community, that, people are concerned about their information being stored somewhere.
Definitely. Heather, Ms. Check.
Thank you. So I'm not super familiar with all the ins and outs of the contact tracing, but I do know that any information that we collect with the contact tracing is stored in a health information exchange program. And so that's all HIPAA compliant and protected. And then any data that we give out either publicly or to the local health department, any information that's disseminated is all de-identified. So we don't give out any identifying information. I will put one small caveat on that, in that CRISP, which is our health information exchange, they do have agreements with the University System of Maryland, and it's through a separate MOU that is not with MDH, but it's between CRISP and the system, where they did agree to share student rosters so that they could do contact tracing within the university. But anything like that would require a separate MOU with the entity that is engaging in that.
Okay. Thank you for that explanation. On page 10, it talks about the work group shall include, and so was the thought there not to be prescriptive because all the language was struck as to who would be on the work group?
That's correct.
And why was that? Why did you guys decide to do that?
Erin.
I think a lot of times, so we struck the legislative members. That just happens sometimes. You just want subject matter experts on the group.
Okay.
That was the idea there. And actually,
Okay.
it's just starting the language that's on pages 10, lines 10 through 12. All that in the original bill, it had subject matter experts, people in local health departments, relevant stakeholders. You just want the people who could help forward the recommendations that the work group would set
Right.
forth.
Right. Okay. And almost done with my questions. A lot of the stuff on the remaining pages, I think, are things we're already doing. So I guess you're just codifying, we've had discussions before about instead of a law, you could write a letter. But it looks like we're just codifying stuff that's already happening. Is that right?
That's right, because we want in the discussion in the Senate, they had a work group is to have a comprehensive plan and include it all so that we know what that plan and outline is.
Okay. All right. And if we would, it'd be helpful to get a revised fiscal note so it, it reflects that these funds are already allocated by the federal government. It's not going to be, an additional $100 million from the state budget.
There is a revised fiscal note as the Senate bill passed. So if you look that up, that shows.
Okay, I didn't even look because I assumed with all these changes, it wasn't revised yet.
No, yeah.
Well, the House changes should not really impact the federal fund implication.
The fiscal end of it. Okay,
Yeah.
Thank you.
Because we in fact got rid of some stuff from the Senate. Thank you, Delegate Shalega, for your questions and for the discussion. Next, we have Delegate Hill. You're ready.
Yes, thank you. So let me just say, I was getting a section about the testing availability and the small section about the vaccine. So that's not really a question because the pharmacy reference had to do with testing where there's not a problem with the volume. But the question I do want, there's good work in here about the testing in nursing homes and other conjugate living facilities, assisted living. There's absolutely no mention of the other major conjugate living facility, which is our prisons. And I wanted to know if they're deliberately left out in our use of the words nursing homes and assisted living as opposed to conjugate living facility, just so I can understand why we're not talking about specific testing programs there as well.
Erin?
I am not aware as to why prisons were not included.
Yeah, we didn't include the prisons. We just dealt with what's in the bill, delegate. So in all honesty, okay, it was a big job.
Gotcha. Okay, thank you.
Then we did not take that one on.
And it is possible that there is federal funding for those facilities. I'm not aware.
I just think when we use the word conjugate living facilities, we would have been safer because we could have defined that and included those groups that people don't like to talk about publicly.
Yeah, I don't know why that
Nursing home, and
Yeah,
specifying assisted living.
Yeah, and it wasn't that we didn't want to talk about it or didn't like talking about it. It was just that we were dealing with these pot of money that were dedicated for the health, outside people in the community. And that was the focus of the senator.
And for the work group purposes, any plan that they come up with does not include that particular group of people who are vulnerable and are coming in and out.
Let's see if Heather has something to say about that, delegate. Okay, 1 second, Heather.
So I just wanted to point out that the health department is already funding the testing within the prisons because in the state prisons, because they are state entities. So we're already funding the testing for that. And then the local health departments, they did get money that was specifically for the local detention centers. So that's probably why it's not included in the
Okay,
bill.
so all that's missing is the plan and making sure that we are having oversight to make sure there's a comprehensive plan that is evaluated and reevaluated. Thank you.
Yeah, thank you. Thank you, Heather, for clearing that up. We have next Delegate Chisholm, followed by Delegate Riley.
Thank you, Madam Chair.
Thank you.
We've got all this Fed money that obviously we're using right now for some of the vaccinations, some of the testing. I understand we want to tighten up on the strategy and the contact tracing. One of the things that I don't see in the bill that I think is very important, especially now, for instance, I know at FedEx Field, we just opened a new location down there for the 3 approved FDA monoclonal antibodies. For the people that are getting the virus, that are most vulnerable, these are usually the people that are just getting ready to go into the hospital. And these treatments have become extremely effective. Right now, they are being paid by the feds. And I'm hoping that, as we progress, science is getting much better at the treatments as well. Hence why we don't have as many fatalities, even though some of the positive cases may be going up. It's because our treatments are getting better. And I think we need to make sure somewhere we're using these federal funds to focus on the treatments as well, because these are the people right now, usually they have a comorbidity, they're getting ready to be hospitalized, or they already have been, and we're using some of these treatments extremely effectively and saving a lot of lives. So I don't know if it's something that's in another bill. I just want to make sure that if we're going to be using these federal funds that are coming in, and I do believe we are using some of the federal funds now for some of the treatments, I just want to make sure it continues.
I know that the local health departments are encouraging people and letting them know about it. I think that the issue here that I can see when you start being prescriptive with certain treatment is like, where does it stop? And you left this one out. I don't know.
Well, I guess my point is it's okay to know that somebody's got the virus, but what are we going to do to stop it at that point?
I don't know, Erin, if you see anywhere where we can reference to that anywhere under the local health department provision, or what do you think?
I mean, we did add some language with the $25 million grants that the local health departments could use it for COVID-19 response, for which federal funding is authorized. So if a local could kind of defend that maybe they had a treatment option that would fall under authorized federal funding. That's the only
Yeah, because-
part that I could see that in this bill. And I will note
Yeah.
that, the money allocated under this bill is a fraction of the money that's coming from the states, coming to the
Right,
state.
I just want to make sure we can fund it. Obviously, the FedEx Field one's obviously in the chair's backyard or vice chair's backyard. And I think it's it's certainly an important effort being put forth to save lives at the point where they're probably at the highest risk. And I want to make sure.
I think I agree with you, Delegate. I think that on page 6, line 30, I agree with Aaron, where it says for fiscal years 2021 and 2022, the department shall provide 25 million each in grants to local jurisdiction to expand capacity for COVID testing and contact tracing, and then or for any other public health purpose related to COVID-19 responses, which federal funding is authorized. And since they authorize that treatment, I would imagine that they could, use it for that.
Okay, thank you. I just wanted
My
to.
pleasure. Thank you for asking the question. Delegate Riley.
Thank you, Madam Chair.
My pleasure.
Yes, I'll start with the other delegates before me answer some of my questions, but I'll start with the funding because Delegate Schlega had mentioned that. I did notice, significant funding in the bill. And I noticed that there are federal funds. Now, in the bill, it says something, if the federal funds or the grants run out, that it would then become the jurisdiction's cost to them by different kind of grants, or?
No, actually, they would still get the MDH grants.
Okay, so it's a different grant, but they would still be.
It's still federal funding.
Still federal funding. Okay, thank you.
So if you look at page 18, line 5, it's all federal funding.
Okay.
Percent. And
So-
that's page 18, line 5 through 8.
Okay, so for instance, if that's the case, if something would happen, God forbid, and we no longer get these federal funds, does this end? The requirements of this bill, would that end? Or would we then make the jurisdictions and the state and, taxpayers pay for this?
According to the bill, it's only federal funding. If there's no federal funding.
Okay, I just wanted to be sure.
Yeah,
Thank you,
absolutely.
yes.
We drafted it that way.
Yep, I saw where you put that in there, so thank you.
Yeah, my pleasure.
And then under the opposition from MDH, but you said you spoke with all parties, so maybe you fixed this, but they were concerned about the federal, staying with the federal funding, that there are certain qualifications that they have to follow. So you're saying that the way that this bill is currently drafted, it follows all the federal guidelines. So there's no possibility that, if we pass this, the federal government can say, oh, no, that bill doesn't qualify for our funding that we're giving you under these grants because you did A, B, and C instead of, DF.
So we work closely with Simon
Okay.
regarding
you're
where the money
pretty
was
confident?
coming from and I'm pretty confident. He knows his stuff.
Okay.
Yeah.
All righty. Thanks.
Simon
Thank
is
you.
great. I mean, no disrespect to Aaron. I mean, it was Simon who was in those meetings, but he's wonderful.
Okay, alrighty. And then on the other one from some of the universities, they're talking about in the bill, I guess, they're saying that we're asking for the universities and I guess the other facilities as well to do a different kind of testing than what we're currently using. And they said that may require more study and more funding than what we're spending now. Is that an issue? And why aren't we just using what we have? It was called PCR.
Yeah. What line are you on?
I'm on the Maryland Independent College of Universities Association.
No.
Their opposition
anything
letter or
about
their
that?
letter of information. Down the last paragraph, and they point out the 1, 2, 3, 4, and they talk about.
I'm looking for the letter. I don't know that I have that letter. 1 second. Aaron, do you have it?
I don't necessarily the letter, but like page 11 of the bill, it's broad that these institutions of higher ed that have residence halls, all they have to do is establish a security plan that includes screening and testing procedures that will keep students, faculty, and staff safe, and then post those procedures on the website. So
It's not prescriptive after any
prescriptive at
test.
all.
Okay, okay. All right, well, that's good. All righty. I think that's it. Thank you very much.
My pleasure. 1 second. I don't see any other questions or concern on the, Delegate Riley, your hand is up. You're gonna take it down? Thank you so much. I appreciate each and every one of you. I appreciate your questions. It makes it a better bill. Erin, thank you for spending, you were up very late last night doing the, you know, getting us ready and amending this bill with staff and with leadership. So thank you so much. Why don't we start with the amendments, Erin? How should I move it? You've been keeping track of it?
Yeah, so you have the reprint before you, and then you have the PDF, which was the separate amendment that would delay implementation of the facility fee legislation from 2020. And then I will add an amendment offered by Delegate Rosenberg that the work group would look at the use of federal funds in implementing the recommendations. And then Delegate Shalega's that when MDH proposes their plan, their 2-year plan, that they would consult with MSDE. So those would be amendments that would be added.
Great. So on the bill as amended with the amendments, so I have to vote on the amendments first, right?
Move the amendments.
Move the amendments, yes. You would
Okay,
have to move the
so if
amendments.
it's moved in second, any questions or concerns regarding the amendments? All those in favor say aye.
Aye.
Petition? I see none. On the bill as amended, may I have a motion, please?
Move the bill.
It's been
Second.
moved in second. Although, any questions or concerns? I don't see any.
sorry,
All those
Madam
in
Chair.
favor?
Oh,
Yes.
hand, hold on. Hand, I'm sorry. Find the hand and the volume all at one
It's
time.
okay.
I
Thank
did
you.
have one more question before I actually take a vote.
Sure.
So in this bill, with the contact tracing and everything, and even getting the vaccine itself, nothing is mandatory as far as the person coming forward.
There's nothing mandatory,
Thank you.
okay, except the use of federal funding. Any other questions or concerns? And I know Erin was saying no. I see none. All those in favor of the bill as amended, say yes. Okay, any opposition? I don't see any. The bill passes unanimous. I want to take a minute and thank everyone for your wonderful questions, for your wonderful suggestions. It really makes it stronger. And I want to thank all of you that have been involved in the department. Heather, thank you so much for being here, and thank you for meeting with us. I'm so grateful for your work, and give my love to Webster. And thank you everyone for being with us today. I think that concludes the bill hearings today on these two bills. We are going to meet tomorrow. We have a couple more bills. Erin is going to send you the information. We probably are going to meet after session or sometime in the morning. She's going to send you the notice as always. Erin, I want to thank you very much for being so flexible. All right, and my staff who's staffing, you don't see her, but it says Senate Bill 741. Senate Bill 741, I want to thank you very much, Edith, for staffing us. You guys, you have time to eat, I think. I think voting is at 4 o'clock. I know we have back rooms, so thank you so much, everyone. Have a blessed afternoon.